Thank you. In 2017, the Trump administration declared a public health emergency to combat the opioid crisis. And in 2018, Congress passed new opioid legislation, the Support for Patients and Communities Act. In your view, have sufficient legislative steps been taken to address the opioid epidemic? Also, and here I am drawing from questions submitted to the debate organizers from 2 District 24 residents, how can the efforts to battle opioid abuse be balanced against the pain management needs of those who suffer from chronic pain? And I'll start with John Began.
Yeah, so first I would like to say I drove an electric vehicle here today. Yeah, so the opioid epidemic is one that is seen around here, it's seen across the country. I think in some ways the efforts have helped. There has been a dramatic reduction over the years. There's still room to move forward there. The one bad part, and that's kind of the end of the question, is that there are a lot of people who have chronic pain, and they need to manage that chronic pain, and that in many cases means opioids, legal opioids. But we have cracked down so much that we've made it very difficult to get access to that in the first place for those people who need it for chronic pain management. So that is, I think, a place that we could do a better job of to make sure that the people who need these medications can get them, and then the ones who don't need those medications do not have access. One thing that's not talked about a lot with the opioid epidemic is the fact that in many cases, needles are used. And something that I push back against Mike Pence on is a need for a needle exchange program. I support a needle exchange program. Because of a lack of a needle exchange program in Indiana when Mike Pence was governor, the rate of HIV skyrocketed. That is completely unacceptable, and it is something that I will certainly fight for that needle exchange program.
Richard Fleming.
The opioid crisis is one of those that just keeps increasing, seems like every year after year. 2 years ago, there was a kid that played with my son on his high school football team, and I guess he was experimenting with opiates. Supposedly he had been experimenting for about a month, and he ended up dying of an overdose. And so when I talk with the local leaders, they don't have enough funds. I know some folks that are looking, that have clinics in Dallas area, but they don't have enough funds coming from Dallas County or the federal government to help with the opiate crisis. But there are funds that are out there, but he was saying that the application process of trying to get certified, because you have to have that doctor and you got to have a nurse to make sure, because there are certain drugs, I guess the methadone and some other items that they use to treat some of these opiate addicts. We have to make sure that we fully fund it. And I don't think that, I got a next door neighbor, she came out and said she had to, go and get herself checked in, but her job, I guess she didn't have the adequate insurance, so she couldn't really get the treatment that she deserved. So, I'm not saying that the government should fund everything, but, I think that we ought to make sure that we fund. Of course, I don't know what the appropriate level is right now for Dallas County, where I'm at, Dallas and Denton County. But from what I hear is that there's not enough funds in it.
Candace Valenzuela.
So I shared with y'all that I was in a car accident my senior year of high school, and I had chronic back pain. And in order to support myself and take care of it, I had to have several jobs. And the several jobs went to having an adequate pain management specialist who didn't actually put me on opioids, but I was in a careful balance of muscle relaxants, but enough to be able to get through what I needed to get through at school and at work. And I also had to pay for physical therapy and my health insurance on top of all of that. And what it all comes down to is, again, we need health care in this country. The opioid crisis is one of the symptoms of the diseases that we've had a healthcare crisis for years. High quality physical therapy, careful pain management, those things can get you back on your feet and back to work quickly, and it keeps you off of opioids if possible. Or if you have to be on opioids, having careful pain management treatment, having things like paid sick leave, those are things that are going to help us combat the underlying cause of the opioid crisis. And in terms of handling the disease that we have now, we need to have treatment centers for folks. We need to treat people with compassion, and we need to get them back on their feet, because ultimately they don't want to suffer from this either.
Jan McDowell.
One of the big problems with with the opioids seems to be the overprescribing by medical professionals who are doing it fraudulently. And they are the drug dealers, even though they are MDs or pharmacists and professionals in the healthcare services. So I think that there needs to be an aggressive program to prosecute those people as drug dealers, just like any other drug dealers, and the consequences that they face. And again, just as Candace was saying, healthcare is critical. So when you have a problem, if you start to become addicted, you need to be able to access healthcare, counseling, treatment for the addiction, as well as the original pain that got you on it in the first place.
Kim Olson.
Well, I'll just share with you, when a veteran is injured overseas, they will give them pain drugs in either to get them to the hospital or get them somewhere in an advanced place so they can handle whatever injury they sustain. And for those of you that know, we do very well on the combat field. People live from having an ID go off and losing all their limbs, and they don't bleed out because we're so good at critical care at the site. But then they live with this pain, and many times they're prescribed drugs that then they end up hooked on for the rest of their life. One thing we have found, though, is in being prescribed drugs that people will shop for meds in order to maintain their addictive behavior. And one way that you can solve that is if you have an interoperability among all of the hospitals around the country, so I don't go running up to Oklahoma to get my drugs and then come back down here. That's doable. We do it within, again, the VA system. We haven't worked it out between the active duty yet. The second thing, many vets, and I just speak from my experience of running a nonprofit with them for 5 years, is that CBD tends to help a lot of times in pain management. We have to be able to find and use federally, approved systems in order to make sure that we prescribe that, but we should not make it illegal. And then the last thing is, I'll just remind you all that 61,000 people died to opioid addiction and overdose, and I just think no one has been held accountable, to Jan's point, and someone should.
Sam Vega.
Yeah, to carry off Kim's point there, that's the biggest issue there. So many people have lost their lives to this crisis, and nobody's been held accountable. And I think we need to go after the people who are accountable, because they not only pushed this knowing how addictive it was, making their doctors make sure that they prescribed it to people who have legitimate reasons for needing these pills sometimes. But they made billions of dollars doing it. Billions, and they have gotten fines, sometimes millions of dollars, and what is that to them? I sound like a broken record, but it all comes back to the greed here that we are dealing with as a society, the system that has built this and rewarded this. And we are all part of it, and that's just true, but we need to make effort to change that. And we need to absolutely go after the people who are behind this, because they have not been held accountable, and it's beyond time that we make sure that when corporations do these kinds of things, that they do not get away with it.